Close to 30% of Americans will have degenerative disc disease at some point in their lives. This is what degenerative disc disease looks like on an MRI. You can see the disc is flattened out, it doesn't have as much cushion, and there's this white area around the disc that's inflammation in the bone that we refer to as modic changes. Early on in disc degeneration, these little tiny nerve fibers that go into the annulus fibrosus or the tough outer coating of the disc will send pain signals. As disc degeneration continues to accelerate, you see changes in the bone surrounding the disc on MRI. This starts with type 1 changes that are inflammation and edema, which progresses to type 2 changes that are fatty infiltration, and finally type 3 changes that are sclerotic changes in the bone. The pain from this inflammatory process in the bone is sent by this nerve, the basovertebral nerve that lives in the center of the bone. Even 5 years ago, we didn't have a lot of good treatment options for this. Usually patients would do physical therapy, they might get some steroid injections, or they'd been on lifelong medications, and that sometimes didn't even control their symptoms. But now we have basovertebral nerve ablation, where we can actually go into the bone and burn or ablate that nerve. The data for basovertebral nerve ablation is some of the most robust data that we have in pain management. This is the SMART trial, which was a large randomized controlled trial in 2018 to evaluate the efficacy and safety of basovertebral nerve ablation. It included 225 patients in the US and Europe that were randomized to either basovertebral nerve ablation or sham therapy. All these patients had chronic low back pain for greater than or equal to 6 months. They had type 1 or type 2 modic changes on MRI, and they had exhausted conservative therapy without improvement in their pain. They followed these patients out for 2 years, and 47% of the patients that had basovertebral nerve ablation had greater than or equal to 75% pain relief. 34% of patients had 100% pain relief. There was a 93% decrease in post-procedure injections and a 65% return to normal activity, and 79% of patients said they would have the procedure again. As with all things in pain management, it's about patient selection. So doing a good history and physical examination, looking at the patient's imaging, and then being honest with the patient about their likely results from the procedure. So if I see lots of other problems on their MRI, it's unlikely that this procedure is going to give them 100% pain relief. But it is a promising therapy that does help a lot of patients when you see that this is their primary pain generator. So as always, leave your questions in the comments, or if you've had this procedure, tell us about your results.